Perioperative nutrition is increasingly becoming a standard of care in a comprehensive multimodal model for orthopedic surgery. Supported by a number of published randomized trials and utilized at the world's leading orthopedic hospitals, MEND joint replacement is quickly becoming the standard of nutritional support for total joint surgery. Numerous published studies show that MEND's specific blend of essential amino acids can preserve muscle, accelerate return to function, reduce key inflammatory markers, improve blood albumin, and possibly even reduce pain. MEND is revolutionizing nutrition as essential to the patient care model through deep clinical research and proven outcomes. Both surgeons and patients agree that MEND joint replacement is improving the world of orthopedics. My recovery with MEND was definitely faster and easier than my other surgeries. It's been 12 days after surgery. I am still taking MEND, and definitely it is speeding my recovery. I am seeing clear improvement in wound healing in my patients who are taking MEND. I have sent MEND to 3 friends recovering from major surgery, and we have all been impressed with the results. To incorporate MEND joint replacement into your practice, contact MEND about becoming a partner today.